Yeah.
Hi everyone, I am Dr. Fawaz Siddiqui and I have here with me my colleague Dr. Lhari.
Very good afternoon to all of you.
And today we are here again with another talk show which PIDC is trying to have every month as our commitment to adding value to dental education. And also in this COVID situation, we are trying to keep everybody updated. And PIDC, Penang International Dental College, has started this talk show which happens once every month. So in today's talk show, we have two very eminent speakers. And Dr. Lari, why don't you tell us about the speakers?
Yes, of course. Thank you so much, Dr. Fawad. It is indeed my a pleasure to welcome our speakers today. We have with us Dr. Ong Ai Leng, the Deputy State Health Director for Dental Services of Penang, and also Datin, Dr. Naziah Binti Ahmad Azli, who is the Chief Executive Officer of Penang International Dental College. Thank you so much, Dr. Ong, and thank you so much, Datin, for joining us this afternoon. Let me just begin today
Assalamualaikum.
by
Hi, everybody.
hi. Yes,
Yeah.
yes, indeed. So to begin today's talk about opportunities for employment, I'm sure young dentists out there are waiting to listen to both of you talk about this topic. And I would like to begin by asking Dr. Ong. It has been a long journey for you from where you began to where you are today. So, can you just give us your experience and tell us your story about how you started off from your early schooling years to where you are right now in your career in dentistry? Dr. Ong?
Oh, thank you, Dr. Lati. Just a brief one. Good afternoon, Datin, Dr. Thank you for the invitation for this talk show. Actually, not much to say about myself. Actually, my town is actually Bukit Metaya. All my primary schooling and secondary school are all Bukit Metaya. And I did my uh, Bachelor of Dental Surgery in University of Malaya, and also masters in community in dentistry also in University of Malaya. And I first started my service in Negeri Sembilan in year 1986 lah. That was my first posting in a very rural and remote town, which is Jelebu and Pertang, where I served for 3.5 years. Following that, I was transferred back to Penang in 1989. My first clinic was in Pergigian Aitam. Uh, Following that, I was posted to a few other clinics on the island, and I was appointed as the district dental officer in South Peds district in year 2014 after I completed my graduate study. And later, I was posted to Northeast district as also as a district dental officer, and I was appointed to the current position in 1st of September year 2019. That's a brief story about myself.
Right. Thank you so much, Dr. Ong. Indeed, I mean, that was a very, humble beginnings, and then thank you, you shared that with us. Let me now ask Datin to tell us a little bit about her journey.
I
In
mean, Datin must have graduated before Dr. Ong. So I think we have
Oh,
more
yes,
history.
definitely. Of course. Yeah. Well, if Dr. Ong said her journey is long, mine is longer, and I've got a longer journey, and I'm more ancient than her. Let's put it that way. Okay. So anyway, I studied my BBS in Baghdad, Iraq. That in itself is a very colorful part of my life. I was there in 1977, where I went immediately after my equivalent O levels, I think, here, right? So I was involved, not to say involved directly, but I was there when two of the wars started.
oh,
The war between Iraq and Iran, and the war between Iraq and Kuwait, which is just the final end of it. So I didn't get the full blown there, but the war between Iran and Iraq was left. It was quite an experience for me. But anyway, it helps to make me stronger, I think, and to look at life differently. So anyway, upon my graduation, which was in 1983, and I know some of the young listeners here are not even born yet, but anyway, just like Dr. Ong, I was also posted a rural place, supposed to be posted there, but I was lucky enough that someone else nearer the town was transferred to KL, so I got that place, So during my time, when most of us graduate during the year that I graduated, we were sent to East Coast of Malaysia, okay, which is Kelantan, Terengganu, or Pahang, because those days, even the East Coast of Malaysia was having shortage of dentists. But now, in recent years now, the young graduates are sent to East Malaysia because they are trying to fill up the posts in East Malaysia. But during my time, it was not even filled up in the East Coast at that time. Okay, so that was in 1983. So I don't have experience working in many states actually. Only a total of four states if you include Putrajaya. My first state was in Terengganu. So I worked in Terengganu for 4 years. And then I asked for a transfer to Perak, which is my hometown. 4 years there, about 4 years there. And then in 1991, I was transferred to the Children's Dental Center and Dental Training College, Malaysia in Penang. It was a good transfer for me because it was something different. And I was there for majority of my service years, which is equivalent to about 25 years plus. So in the college, I learned a lot about training because they train the dental auxiliaries there. So I learned quite a lot about training and even became resource person, especially for the allied health personnel, the dental allied health personnel. So I think it was very fruitful for me, a very good experience. And then following that, I was transferred to where Dr. Ong is now, in Penang, as the Deputy State Director of Health Dental, where I worked for 3 years. And then finally, I was posted to the ministry, which is in Putrajaya. Before I got myself retired, compulsory retirement or mandatory retirement, they call it in the government service. And then I'm now in PIDC.
Wow, thank you so much, Datin. Lovely. I mean, to face a war during your studying years is such a challenge. And those days there was no internet, there was no phone, so I'm sure it would have been very tough. I cannot even imagine putting myself in that position. Yeah. So I think yeah, COVID is like we're feeling we're facing that, but then I'm sure those days would have been very, very challenging.
I was just looking at the screen here, and I can see three very pretty ladies, and I am the only odd man out.
Oh, it's okay. It's okay. The Fawaz is okay. It's now in the dental fraternity. If you look at around you, majority of us are females. So bear with us.
Yes. I mean, it's something to be very proud of. Actually, the women in dentistry have really done well for themselves.
I don't know. I want to ask Dr. Ong, how are the females are applying more for government post, or is it the males applying for the government post, or the males are trying to move towards private practice and the females want to join the government post? How is the situation currently in government services, Dr. Ong?
From what I observe, males and female are equally interested to join the government service.
Oh, very good.
And
Yeah, I support that statement actually, because I think the perks in the government service is over the years is extremely good now compared to the times when we started working.
working with the government in view of the quite the COVID-19 quite affecting the business opportunity also.
Yeah.
Just for the sake
Yeah.
of the young students who are starting their career in dentistry and dental, Dr. Ong, can you just tell us the pathway a graduate has to cross to join a government service as a permanent officer? How is it the career pathway? Say somebody who has just completed BDS and has completed his 1 year of compulsory government service. From there, what is the career pathway for entering into permanent government service?
Actually, on the compulsory service, government service is for duration of a year. On completion of the compulsory service, the Malaysia Dental Council will issue a letter of compulsory service completion for the other graduates. So they can either opt to go to the private sector, which in Penang from 2017, which is the first batch, until today, which is the third batch in 2019. So far, only 76 uh, doctors has left government during contract, resign, which I mean resign. And that accounts for about 34.4%. When they resign, they could be joining the contractor. Okay. Another option is they can join the university, which may be the private or government-based university. So, so far, there's only one dental officer who has left KKM during the endo new dental officer period to join the HUSM, the permanent officer. And the third option for those who have completed the compulsory service could be joining the army. They can join the army as a dental officer. Okay. So far from Penang, there's no one that joined the army. And or they can be after the compulsory service of 1 year, they can work for another 2 years, the contract also. And then they also can apply to get a place as a permanent officer. Actually, this one depends on the performance of each candidate of the cohort. Okay. So far from Penang, experience is between 30 to 50% of the dental officer, which means from batch 1 year 2017, has been appointed permanent officer. So between batches, it varies. Okay. Also depends on the availability of posts. A majority of the dental officer who has been appointed to permanent posts from Penang actually has to leave Penang for other places because so far Penang did not get any officer being appointed a permanent officer in Penang. All left for other states. Maybe because the availability of vacancies in Penang, vacancy posts in Penang for dental officer.
I think
So
Dr. Lari, when Dr. Ong said about having for them to move to another state, you know, to be transferred to another state. This is one of the big challenge in the public service, where we have to be, you know, you cannot stay in one place. You will be transferred. There is that possibility of being transferred. Yeah.
So that's why I guess it brings in the choice for candidates who probably would want to get transferred or do not want to get transferred, and then they make a choice of whether they need to be in the government or they would want to move on to the private sector.
So I don't know, on an average, how many transfers does it happen? I want to ask Datin, in Datin's career in the government service, how many times did you get transferred? So I'm just trying to make sense of that. If I join the government service, the average
Oh,
number of transfers I will have is how many?
I think I'm one of those lucky ones, because I found my niche, you know, and my niche is training for the dental auxiliaries. So there were not many dental officers in the government who are interested in that field. So because of that reason, you find that even though I get a promotion, that by administration they had advised me to stay put. So I was lucky in that sense. But most of the others, maybe perhaps Dr. Ong herself, probably, when they get their promotion, usually it comes with it. That was before, right? It comes with it where you have to be transferred. But however, I cannot remember which year, when the promotion became a time-based promotion, where it depends on the number of years you're working in the service and then you get promoted to a certain grade, then you find that they can be wherever they are and get promoted.
Okay.
So in a way, it's good because the profession, the profession within the Ministry of Health becomes more attractive to people because of this, of the time-based promotion. But the disadvantage is that it's very difficult to get people to move because they know that, to a number of years they are in service, they're going to get this grade, and why should they move now? So they wait for that time-based promotion. So this is one of the biggest challenge, I think, that we face. Even when I was working in the ministry, it is unless you get that person promoted, then link that promotion with a transfer, the person will not move. So it's a big challenge. I think even until now, right, Dr. Ong? I'm sure you're facing the same challenge, yeah.
Yes. Actually, most of them got promoted at the same place. Actually, the state also has the prerogative to suggest or transfer for these officers who has been promoted, and we can propose to the ministry also for
Yeah.
them to transfer to other place. If they has been working there for more than 5 years, it is advisable for a government officer to be transferred, preferably after 5 years lah, when been working in the same place.
So answering
So,
Dr. Fawaz's question just now, as I mentioned to you, I actually just had experience in 4 states only. Yeah, and some of my seniors and maybe other colleagues, they have moved to several states.
Okay.
okay. And Dr. Ong, how many transfers for you?
For me, only 2 states, 7 times transfer.
Oh,
Yeah,
7 times.
she's the lucky one.
Would you say it's lucky, or would it be like, sometimes?
Burdensome.
Yeah, I mean, maybe if you're transferred to another state, you get to see more, you get to meet new people, and experiences are
Different.
different.
I think it depends on the person because
True.
if you are family based, and for example, if your husband cannot move, I mean that place where he's working is where it is. So of course it's difficult for you to move, right, and uproot the whole family. But for someone who's single, maybe it's good. Yeah, it's good to be working in many places to gather all the experience. So I would advise the young single dentists or graduates to accept and move, rather than request to be in your hometown, because when you're young, it's the time for you to collect all the experiences.
Correct. Yes.
True.
True. So,
Just before that, I'll just pick up a question that has come by Akmal Mizeni. And Akmal Mizeni wants to know, if we want to join the dental army, what is the age limit for the application? Should be minimum 28 or less? What would be the age limit to join the dental army corps, Malaysian Dental Army Corps? If Datin or Dr. Ong can help us out here.
I think for this, they have to wait for the advertisement by the SPA. Not.
okay.
Yeah,
Yeah.
age limit, there is no age limit, because once you have completed your compulsory service, as what Dr. Ong mentioned earlier, you can actually go and choose where you want to go. But of course, there must be vacancies. So either you apply for it and then they will inform you whether there's a vacancy or not, yeah, just like even, I think it's the same if you want to go to universities. You're going to join university, you apply and find out if they have a vacancy. What's important here is to complete the compulsory service, which is 1 year.
Right. I hope that answered the question for Mr. Akmal. Then moving on regarding what you have said about vacancies, Datin. So we just want to know from you, like in terms of employment, what are the other choices available after the compulsory, 1 year
Yeah, I
service?
think if I can reiterate what Dr. Ong mentioned earlier,
Yeah.
uh, yeah, that is of course, if you are lucky to be absorbed into the government, then
Hmm.
you will become you will be appointed as a permanent post, which is, I think, as Dr. Ong said, just a small percentage. But that's the universities for people who are interested in teaching or training and doing research, so they can opt to go to universities. And then the other one option is again the armed forces, right? Where upon graduation, I think you will be, as a dental graduate, you will be a lieutenant colonel, I think, and then you will go, you will be, your grade will go higher and higher, and you can even end up being a major general. So there is that pathway there, okay? But also, there is also an option to work uh, in the private practice, of course. Either it's in your own practice or in a group practice, which is very popular, I think, these days, to be in a group practice,
Group
right?
practice.
So, yeah, so that will be upon completion of that one year compulsory service. So,
Right.
for a graduate who has undergone that 1 year, can actually resign at the end of that 1 year and join whatever you know um, opportunities that come their way, they can join. Yeah, if their interest is there.
Right.
Even in the opportunities in Ministry of Internal Affairs, like those who work in the prisons, are there any dental vacancies for prison inmates? Or, for example, we have Ministry of Health, then we have Ministry of Defense. Do we have any other ministries which are hiring dentists or dental graduates, like Ministry of Internal Affairs for prison inmates, or any
Can
other?
you answer that? Yeah.
That I'm not too sure about that. Actually, for those who have already got an offer from university or armed forces and has not completed her 1 year service, actually they can apply to the
Yes.
GPG, for special permission to
Okay.
continue their compulsory service in the university or the army. University, what I mean is the public university and the
Yeah.
armed forces.
Yeah, I think it's true, because I remembered when I was in Penang, also there was one uh, dental officers.
Mhm.
I think they refer them to be new dental officers.
Yeah,
Dental officers who are just graduated, we call them new
new.
dental officers. So I experienced one who actually went to the university to complete the 1 year compulsory service. But as Dr. Ong mentioned, it has to be a public university, not a private one.
So I think that's the question which Mr. Fariz Rehman is trying to ask us. That currently, does any university provide training for NDOC, or we still need to complete 1 year first year in government?
I sorry, can you repeat that? I cannot hear well.
Does any university provide training for NDOC, that is the new dental officer, or do we need to still complete the first 1 year in the government?
Yeah, I think it's just what I mentioned. Like,
Yeah.
they can go there, they can go, and they will provide the training for endo
Hmm.
to complete the 1 year.
Yeah, but that has to
For
be the
example,
government university.
yes, public government
Okay.
university. Yeah.
Yes. So
Uh,
I think that
doc-
answers Mr. Faris's question. Yes. Um,
Even I was talking to some of the senior dental practitioners, and we were talking about how uh, people used to graduate from dentistry and they used to get absorbed in the government services, and that is how the common pathway was: you finish graduation and you enter the government service. But now the private sector has also opened up. So I just wanted to ask Datin, how are the things in the private sectors? I mean, now we have graduate schools which are turning out the dental graduates from private schools and also from government schools. So how is the private sector growing now? How are the opportunities in the private sector? Like you already mentioned about the group practice.
Okay, as far as I know, the dentist population ratio is still not. We still have not achieved it. You know, it is going to be achieved in a year or two, but it is not achieved yet. So there is, I think, that we still have avenue to train dentists, right? Although the perception is that you have so many dentists around. The many dentists around perception is mainly because there's influx of dentists. You know, the supply of dentists comes in a shorter time. You know, if it is a longer span, then maybe it is more manageable, right? But because in recent years, we know now that we have a total of 13 universities offering dentistry in the country, right? You have 6 public universities and you have 7 private universities, all right? So they are controlling the total number of graduates yearly to be about 800, right? So that is why the moratorium comes in. So, but having said that, if you look at the distribution of dentists in the whole country, you have saturation in the big cities,
Yes.
all right, rather than in the remote areas. You still need dentists in the remote areas. So I would advise, as I have told our students, the previous batch who have just graduated, that if they want to open a private practice, they must look into marketing themselves in, not to say remote, but not to concentrate themselves only into the big cities, right? So I mean, there is still avenue for them to open a practice there. Okay,
Right.
so that is an option, but I would think that joining an established clinic as a joint clinic or consortium is also another good idea.
Yeah.
Right, and then nowadays you have a lot of courses that is being conducted. Okay, that was probably pre-COVID, but I think even post-COVID they have courses, online courses and all that, right? Maybe not so much of the competency courses. I think they are working on it. You know, if this COVID-19 pandemic is going to be prolonged, I'm sure people are going to come up with. I'm reading now about simulations, being invented and all that, right? So we it may not be surprising that soon they can even conduct such courses, simulation courses, to allow for people to at least get some certain of competency level. All right, so these courses are available. So even if I remember one of our alumni, the PIDC alumni, he gave a talk, I think last year, to our new students regarding his, how he get himself to be, he attended courses on implants and is now doing implants, right? So I think this depends on the initiative of every dentist, right? If even it doesn't matter if you're newly graduate or if you're working, so you need to be looking out for an avenue to enable you to increase your knowledge, so that you acquire better knowledge, and then you increase your competency level so that you become more marketable, right? This is especially so for people working in the private practice, and courses are available. So I think you can enhance your competencies in that way,
Right,
as well.
I think
to be competitive.
Absolutely. I think I agree to find that niche.
True.
Every dental graduate must find that niche within that first year of compulsory program, so that they can take a step towards government service or absolutely.
And not worry about the urban saturation, but to move on. Right. So, Dr.
Because
Yeah.
Yeah,
Sorry,
Clary, if I
Datin.
can just add in a bit, I think in the mind of the new dental officers,
Yes.
they must of course, I suppose during this era, majority would want to be in the government, right? To join the government service, but that should not be put as the only goal. Of course,
True.
I know if you want to be absorbed in the service, you must have some criteria, you know. Maybe Dr. Ong can tell us later on what are the criteria to be absorbed in the government service as a permanent post. But let's not that be your only goal. You must have a backup. You must have a contingency plan in case you are not being selected. All right. So this contingency plan must not come in at the moment that you realize that you are not being selected. It must already be on day one. You must strategize in such a way that you are marketable even in the public. That means, what is it? How do I fulfill the criteria that they want? Or on the other hand, what if I don't get it? Now, what are my options? So that must be very clear, because during these times, it is not like before. During my time, during Dr. Ong's time, upon graduation, our employment is in our hands. It is in our palm, you know. There's no doubt about it. You don't even have to look for it. The government will look for you know, and then you just have to register, and then they will know where you are, you know, and your names and everything, and they will contact you and you're offered the job. Those days are gone. Right? So the young graduates must think differently, think out of the box, and whatever they do, they must make sure that they have that strategy ahead, you know, so that they can already carve their path.
True, true. Well said, Datin. That's so true. Just moving on, I mean, regarding the same topic that we're talking, I wanted to ask Dr. Ong. Now, since Datin has told us that, what could be the personality traits of a person who actually gets absorbed in the government service as a permanent officer, and also the personality traits of a person who moves on to get absorbed or get selected to do post graduation.
So actually, thank you for the question. Actually, the first year, the new dental officer are required to complete the clinical logbook, you see.
Yeah.
And the endo will be assessed based on the clinical skill
Okay.
and also the general assessment part. Actually, the general assessment part carry a very high weightage lah on the overall technical performance of the uh, new dental officer, and the general component uh, has a 5 domain actually. It carries somewhat like 50% of the overall logbook appraisal for new
Oh.
dental officer. So the general assessment is very important, and the 5 domains are the professionalism. And here they will be assessed on the display on good clinical judgment and able to refer when necessary. And also they must demonstrate responsibility, accountability, and also to comply to work process, example the SOP. This is very important. And the second domain is on the communication skills. The endo must be able to articulate ideas effectively, especially during meetings and group discussion. And also all responses, spoken or written, are tailored to the needs of the recipient and be compliant, or demands are responded in a polite manner, and also to display interpersonal relationship with clients, patients, especially and subordinate and colleagues. These are what are the traits that we look for the logbook assessment. And also the teamwork. There must be teamwork spirit among them to participate as an active team player in any group discussion, and also to cooperate with other team members to achieve our goals uh, for the clinic. And discipline-wise, they also have to adhere to punctuality, timeliness, sense of urgency. It is very important. Whatever work that are given must be completed within the deadline. There's no delaying in it. And also to comply to rules and regulations. And the final domain is on the personality of the person.
Okay.
Uh, they have to adhere to guidelines on dress code, discipline, display ability in adapting to changes, especially flexibility, and also display proactiveness and innovativeness, and also in qualities. Other than this, they are also to be advised to be actively involved in the um, promotion,
Health promotion.
the health promotions, innovations, KIK, UA study, and also research and publication. These are the areas that are on top of that. They are also much encouraged to do talks and also active as a ahli jawatan kuasa in any team lah to
Mm.
some activity. Yeah.
So I
And
don't know.
Yeah.
So
so
I want to ask Dr. Ong. I mean, we have a wide range of.
from the officer in charge, they are interested to take part in this. They are interested to do this. Not wait to be served. So they
Ah.
must show their interest, go forward to grant. Okay. Some of the endos are very active. They really come forward to the officer in charge of the clinic that they want to be involved in this, involved in that. And also maybe can be even uh, in the assistant set in the clinic. Uh, There are
Oh,
examples, a few activities, and also to do presentation. Ah, This is very important. Presentation at the clinic level or at the district level, even at the state level, if they are brave enough. Yeah.
Yeah, that's amazing,
amazing.
Dr. Ong. You've told us so many important points. I hope the listeners are jotting it down. At least I have jotted down the five most important domains. So
Yeah,
maybe at the end of the talk, we'll just summarize
The
all of those again. Yeah,
other
Dr.
yeah.
Fawaz.
I also want to ask Dr.
Dr.
Ong.
Lahari,
Sorry. Yeah.
can I just sum up what Dr. Ong has said? That the information that she has given, all the
Yes.
more, the faculty of members of the IDC have a responsibility to ensure that our graduates have a holistic kind of training to prepare
So
themselves, to prepare themselves for all the criteria that the government has laid down to be
yes, yes, of
absorbed
course,
in
indeed.
the
Yeah, of course. Yeah.
I think in that sense we are quite lucky to have Datin as our chief executive
Yes, I
officer
mean,
because
she's
I
given
think
us insights into how what is expected of an officer when they join first, and then you have told us such important information, Dr. Ong, that at least officers can groom themselves to achieve the most important thing that they want to, that is getting absorbed as a permanent officer or getting chosen to do post graduation. So
I just wanted to ask
yeah,
what kind of support is provided for the students in the government service. Like Dr. Ong just said that the student has to
the
take
dental
self-initiative.
officers.
The dental officers,
Yeah.
they have to take the initiative and they have to come forward and be brave and put up ideas. What
yeah,
kind of support the government uh, training centers provide for these students? Because I'm wondering, I've seen so many students, some are very high achievers and some are those shy ones.
yeah.
So
Assessment is for the duration of 2 years, you see.
Yeah.
And there are so many variables involved. Some parents might think that, oh, because of the officer in charge in the clinic, that's why their daughter or son did not get the permanent
Ah,
posting, you see. That is not true actually. There are so many factors and variables involved in the criteria involved in the selection of this candidate. So it's not on one sole variable only, you see. So during the orientation course for the new dental officer, actually they are exposed to all this. The checklist also has been given to them. You see, what are they being assessed on? What are the criteria? What they must do? So that they can get marks. So that they are able to help them, so that they are more focused on what to do during the first and second year. Some, after trying very hard for the first year, during the second year they kind of, or they forgot they are still being assessed, then they kind of slack down a bit. So, and because of this, their second year marks are not so good. So eventually it ended up that they are not being absorbed in the government service, see, not being selected. So
Yeah.
it's very important for
Yeah.
to really look through what are the criteria, what should they be involved in actively, what should they do, see, to help them to get permanent, to be selected for permanent employment. Actually, the checklist have been given to them during the orientation, so there's no way that they are not aware of all this. See?
Yeah.
Hmm.
Right. So I think it's important that all the young dentists and dental officers should keep this in mind and self-reflect whether they are actually following all the guidelines provided.
Yeah,
Right.
they
So
go
I
to
think, if I may add,
yeah,
if they want to get themselves prepared, actually our graduates can explore the website, the oral health program website in the Ministry of Health. I've told them the same message, that they explore themselves, go onto the publication. They even have the logbook there,
true.
the
oh,
logbook
Yes,
for
yes,
the new
So
dental officers, so they
yes,
can
yes.
actually see what are the criteria, how are they going to be assessed and everything. So as I've often told the students, they should, even in fact this morning when I was giving that talk, I even advised them to just explore, go into the websites, the Ministry of Health website, go into the oral health program website, go to the Malaysian Dental Council website and see their publications. So from there they can get an idea and get themselves prepared. And
True,
even
true.
the faculty members also can go in, so that we know what to expect, and
true, true.
in what areas are we supposed to train the
Okay.
students. Yeah.
Absolutely, absolutely. We have a question from Kokhau, and he's asking that if they want to get absorbed in the government service that we have just discussed, what they have to do to get absorbed in the government service as a permanent dental officer. From getting absorbed to permanent dental officer, Dr. Ong, what is the pathway of doing post graduation or a master's program in the government service? How many years of service they have to put in before they can finally put an application for selection for post graduation?
they must be at least 4 years in service, because before they can meet in the application for hadiah latihan persekutuan, scholarship, for the scholarship. Yeah.
So, ma'am, the scholarship is now overseas or is limited to Malaysia?
Limited to Malaysia, unless those courses that are not offered overseas, like forensic or odontology.
Yeah.
Mm. Other
Okay,
than
so
locally.
All of them can be done locally except forensic odontology. Okay, that's an important.
so I
What
think
about?
we have a very important upcoming specialty that is forensic odontology.
Yes, true. That's true.
So I think
Yeah. What about the private sector? I mean, any idea that Datin can probably throw in some information regarding post graduation currently in the private sector?
I think for the private sector, of course, if you talk about scholarship, the scholarship granted by the federal is only for those working with the government. It does not encompass those in private practice. So from what I see, um, private practice is well, let's not talk about private. When you say government, you are saying Ministry of Health, right?
Yes.
But
Yes.
if you are still, if you are working with the government, you have other options. Like, for example, if you are in the universities, one way to get scholarships is working in the university. That is, I think, maybe could be a faster pathway because you can be a trained you can be a tutor initially and then get into their postgraduate scheme, so then of course they will sponsor you. But for a totally private practice, I think what most of them are doing is to attend courses. That is what to attend courses. And you know that with the new Dental Act 2018, you have a specialist register, right? You need to be registered as a specialist. But the other what do you call it, procedures, specialist procedures, is allowed to be carried out by a non-specialist, provided the non-specialist can demonstrate that they have attended courses and all that. The only catch here is that they're not specialists, and they cannot charge a specialist fee, and they must inform the patients that they are not specialists. That is very important because the patient has to know, that. So it's a patient's choice. For example, if someone wants to do an implant and choose that implant to be done by a practitioner, a general practitioner, right? After knowing that he is a general practitioner, so he can still proceed to do the implant. But of course, the fee will not be a specialist fee. Or another patient might want to be the procedure to be carried out by an oral surgeon, right? So that is the patient's choice. But this opens to private practitioners to attend courses to increase their competency level, to increase, their clinical expertise in certain areas. But unless, of course, they get sponsorships from elsewhere, but it is unlikely from the government. Government only gives scholarships for their government officials.
I think this is also a very nice pathway for the dental graduates. They can do primary dental healthcare practice with special interest, say in pediatric dentistry, or a special interest in implantology, and that is how they are doing it in United Kingdom. So these are basically general dental practitioners with some training, say in implantology, and then they have their private practice, general practice with special interest in implantology. So that is also a great pathway if you don't want to do a full-fledged master's program. Even now the master's.
Yeah, because to be a specialist, you have to be gazetted.
Yeah.
You cannot upon graduation come back as a specialist. You have to be to be gazetted first, and this gazetted, of course, involves if I can remember when I was working in the government, where if your training is 3 years, and usually this is overseas, so you have to have an additional 1 year training when you're back in the country, and then 6 months duration for your pre-gazettement, they call it. And then if your training is 4 years, which is the usual in the country, then your pre-gazettement duration is only 6 months.
Okay.
Upon completion, then you are gazetted as a specialist. Okay, so even for those being sponsored by the government, upon graduation, they are not automatically a specialist. They must get themselves gazetted first.
Yeah.
So even now sorry, Dr. Ong.
Yeah, the gazette is 6 months, like what that has mentioned. And also for those who have done the course for 3 years, they have to do another 1 year locally.
So apparently they have not changed the criteria since I left.
So now if somebody wants to do post-graduation, now it's a 4-year program, I think, and that ends with a doctor's degree in the specialty. Is that true?
Yes.
Doctor's degree?
The courses are 4 years actually. Master's degree.
Master's degree, yeah.
Right. Except for public health.
Okay.
Public health is 1+3.
Yeah.
Where you get master's 1 year plus 3 year to do the doctorate.
Okay.
Yeah.
So we have a question from one of the viewers, He Xing Kong, who's asking us, after graduation, is it okay to have a few years gap before applying to the government compulsory posting?
So far, I think that shouldn't be any problem.
So is there a time gap as to how many years would the government accept after graduation?
Normally, people will register immediately after graduation, but there are cases. There's one case a few years back where the dentist applied after I think 2-3 years,
Okay.
a lapse of 2 years.
So are they still absorbed for the compulsory posting?
Yeah, the compulsory service. Yes.
So it shouldn't really be a problem if they have a genuine reason.
Yeah, they must provide a reason.
Okay. Right.
I think
So I think
one of the aims of the government, one of the aims of the government is to ensure that every graduate undergo that compulsory service, because their goal is to so that they can practice
Yeah.
in Malaysia. You know, of course, if they carry their qualification outside the country and work outside, if there is no requirement compulsory service there, they can work, right?
True.
But if
Yeah.
they want to practice in Malaysia, they have to have that compulsory service. And the spirit of the government is to ensure that these people can practice. So that's why I think the compulsory service is open. Even I think if you did not complete 1 year, let's say for example you do 6 months and you reapply, I think the government allows it because they want you to complete the 1 year. Yeah.
True. Right.
Yeah. Actually, the objective of the 1 year program, new dental officer program, familiarize the doctors with the new environment of working, especially in the clinic, and also that at the end of the training, after 1 year, they are able to provide safe and quality services, dental services to the patients. That is the main objective of the compulsory service.
So I just want to ask a question here. Say, for hypothetically speaking, that I have graduated here as a Malaysian, and I took a 2 years gap because of family reasons, and then I again applied for my compulsory government service. In that case, I will be just treated as one of those in the waiting list, or will I get a priority because my age is increasing, or is there something, any criteria for them to be put first, or
I
they just have to follow the waiting list that the government
think
prepares?
priority for those who apply late, is it?
Oh, that's actually very nice. I mean, people may have some genuine reasons they could
True.
not.
Yeah.
Can
I think
appeal.
I think they have now e-dentist, right, Dr. Ong?
Yeah, now e-dentist. Yeah.
And that they can actually choose where they want to be posted, isn't it?
Yes.
Yeah. So for example,
Online.
a young graduate going into the e-dentist and I wanted to go. Okay, I want to go, for example, klinik pergigian, let's say Tasik Lugo, right? And then I find in that list it's no vacancy, so I can choose not to apply that time,
Yes.
right, Dr. Ong? Yeah.
Stay another year, then you or the
Yeah.
next intake, which there are 3
Yeah.
per year. So you can delay to the next intake actually.
Yeah. So what I'm trying to say here is that this question I pose to the young graduates, right, the new dental officers, is the location more important than getting your compulsory service done? You know what I mean? So that
Right.
question is there. So it's a choice. They have given you that choice, so you pick your choice. Unlike before, there's no choice. They will send you anywhere and you have to go. But now it's more friendly. But the price that you have to pay is that if that place that you choose is occupied, then you may choose to wait.
Yeah, like
Right. So
For the
actually
next intake. Yeah.
choose a nearer place to that also.
Yeah.
Yeah.
good point. And that's a very interesting question put forth by Datin to the audience who's watching us. Location
Okay.
versus time. what would you choose, right? Let's hope we get some answers from there. Meanwhile, I think we have just time enough to take one last question. I think Nada Najwa's question about whether after completion of postgraduate programs supported by the government scholarship, dental officers are required to work in the government first or free to go into private practice instantly. So I think it has been answered that 6 months of gazettement is compulsory after the 4-year equivalent post-graduation. So what about the part of free to go to private practice?
I know. Has it ever happened that people have joined the Government Commission and then they get their post-graduation on government scholarship and then they want to leave the government service and enter the private practice? Has it ever happened like this? I mean, how is the government dealing with this?
Yeah, that's after the Jabatan Perkhidmatan Awam. The scholarship comes from there. They have to look into the agreement also. What agreement, with the public service department.
And I must add also that in order to be given the scholarship, I think they have an interview. So they have criteria for the interview, and one of the criteria is you must work with the government. So if you have that idea of quitting and moving into the private practice soon after coming back, I don't think you'll be the choice of someone that they want to give the scholarship.
True, commitment is very important, of course.
I mean, the government is investing so much in you; they want to keep you, and the government perks are very good. Yes, ma'am. The government perks for specialists, the salary and the perks.
It's quite a lot. I think the pay as well as the scholarship. You see, some of them even go without scholarship with full pay. There's approval from the ministry. With full pay without scholarship, because they already got a place in the university, so they do not want to miss out this. So they are willing to go without the scholarship. There are few doctors who have gone for this actually.
Right. So just in time, last question, not to delay both of you any further. From Ashton Chan, he asks us, what are the differences between working environments in rural versus and hospital settings, apart from the number of cases and exposure? That means he's trying to compare a rural setting versus an urban, I understand, or maybe a rural clinic versus a hospital setting.
I think
in terms of the government service.
Before Dr. Ong answer, I think we need to clarify whether he meant private practice or government. I think maybe it's government, Dr. Ong?
Yes, I think so.
I think when you apply for your compulsory government posting, you are put into rural setting or you are put into a government setting.
Yeah, it depends upon how
it depends how the government is posting you. Is that correct? So you may get a rural posting, you may get a hospital posting.
Permanent posting, is it?
No, for the first year compulsory posting.
Compulsory posting.
Yeah, first year. End of.
Yeah. Actually, you'll be posted to the hospital-based specialty, which is the pediatric for 4 weeks, and also the oral surgery duration of 4 weeks. And in primary care clinics, it's quite similar between the rural and urban area. Only maybe the number of patients may differ between these two locations, but basically the services rendered are the same. Yeah.
Right.
So chances of getting into permanent post is higher with rural postings or with the government posting, with the hospital postings?
Actually, this also depends on the criteria which I have just mentioned just now. Rural posting do not have extra points, and also compared to urban posting.
Right. So that's a very that's a very important point, Dr. Ong, that you've told us.
There's no bias at all. You have to work to get your permanent commission.
Yeah. True.
Great.
Right. So, concluding remarks from Dr. Ong.
What is your advice to the young graduates? And the same questions we're going to ask Datin also. What is your message to the young graduates who are graduating and those who have just graduated? or those who have graduated and waiting for employment?
Do your best and try the best actually for the first years to try to satisfy all the criteria to enable you to be selected to the permanent posting. And like what Datin has just mentioned, from the day one, you should have your plan B ready. That's my advice. Because the percentage of being absorbed in the government service is not really that high. Yeah.
Datin, any wise words?
Yeah, don't be dampened by what Dr. Ong has said about the percentage of people getting into the permanent post is not high. Okay, it doesn't matter. Remember, you are a dentist, and a dentist is a professional job. You can carry it with you anywhere, and you can be employed anywhere. You can even be self-employed. So don't worry. What is important is that you keep your professionalism. That is number one. You be professional in whatever you do. Be competent. Be reliable. Be honest. Accountable for all your actions. Keep cool and calm under any pressure. Have good negotiation skills, especially if you are in the private practice, so that you can enhance. You can have networking opportunities if you have a good negotiation skill, good communication skill. Keep your manual dexterity up to date. Okay, continue to enhance your knowledge. You know, you have to update it, knowledge and skills as well. All right, so wherever you are, don't worry. Okay, that is why until now the dentistry is one of those still being sought after. It is not forgotten. It is not put on shelf. All right, so you can be employed anywhere. What's important is yourself. You must be marketable. You make yourself marketable. Okay, so that is my message.
Right. Right. Thank you so much, Dr. Ong. Thank you so much, Datin, for all your advice. I'm sure our young graduates and dentists have a lot to learn. And, I hope this talk has been very informative for them. I'm sure it would have been very informative for them. And Dr. Bhatt, would you like to
Yeah.
say something?
Yes, I really would like to thank Dr. Om for taking out time from a busy schedule to be with us. And of course, Datin is our pillar of strength at PIDC. Thank you so much, both of you.
Yeah,
And
before Dr. Fawaz, before we close, and before I forget, I would like to thank Dr. Ong for her participation in our talk show and for her to agree to be with us. So thank you very much, Dr. Ong.
Thank you
Thank
very
you
much.
very much.
thank you so
Thank
much.
you so much again.
Thank you again.
You,
For
Dr.
our viewers,
Bye.
thank you, Dr. Om. Bye-bye.
Yeah,
Bye.
you can
Bye-bye.
continue to give your questions. We'll try to answer them on our chat section. And we thank you once again.
For the viewers, I would just like to tell you that this talk show is going to happen on a regular basis. And if you don't want to miss any of our future chat shows or talk shows, you can subscribe to our Facebook page here so that you can receive our notification when we are up with the new ones.
Yeah, and
what
don't
is the
forget,
yes,
the recording would be available on YouTube for the ones who've missed it.
absolutely.
PIDC YouTube.
So
You were
don't
saying
feel
something.
missed out. Yeah. What is our next program?
Oh, yes, we're going to have a talk which is going to be conducted by our own students, and it's something going to be very nice, which you need to look forward to in the section of Meet Our Experts. So that's all I can say for now. I don't want to spoil the surprise. Right.
All right. Thank you so
Okay.
much.
Thank
That's
you.
it from us. Have a nice, safe days ahead.
Yes, stay safe.
Bye-bye.
Bye-bye.